Hi, everyone. My name is Elizabeth Wallahan. I'm the Vice President of Marketing and Public Relations at Eisenhower Health. It's an incredibly exciting day today for us, having the first of our healthcare workers receiving the COVID-19 vaccine. And we're really pleased to share with you a few moments with some of the people who have been the first to receive the vaccine here. You'll have a couple of minutes with them, and then that will be followed by a few minutes with April Lopez, who has been part of the team that has put the strategy together to do this in an efficient way for our healthcare workers. So thank you for participating. The first person that we have available for you is Dr. Manny Dejesus, who is one of our physicians in the emergency department here at Eisenhower Health. Dr. Jesus.
Thank you, Elizabeth. Good afternoon.
So if we have questions from the media, if you could raise your hand, and then we will call on you, and then Dr. Dejesus will answer your question. Okay, go ahead, Jake. Let me unmute you. Oh, there you go. You're unmuted.
Hi, can you hear me?
Yes, sir. Good afternoon.
Hi, good afternoon. Thank you. So doctor, can you just give us an overview kind of how many vaccines were given out, sort of the breakdown of which departments are receiving them, and kind of walk us through the process of how it all went down today?
Great question, Jake, but I think I'm going to defer that to Lee Rice. I don't know the exact number. I apologize.
Sure. Do you know, can you walk us through sort of the process of how it's going to work and the scheduling and everything?
Actually, Jake, so if you want to talk to Dr. Dejesus was one of the first to receive. I have April Lopez, who will be on after our first three participants, or volunteers rather, and she will answer all of those logistic questions for you.
Got it. Thank you so much for the clarification, and I apologize.
No
so just talk about why you wanted to get the vaccine off the bat.
Yes. Okay, so essentially, I think I can speak for most of my team here, most of the medical community, not only here in the Coachella Valley, but worldwide. We needed a light. And we needed a light at the very end of this, to something for the very end of this dark tunnel. And I think this vaccine was sort of that first step, that first beacon to get us through this pandemic. And yes, you read everywhere in the literature, there are possible adverse effects. That didn't matter to me. Because I think in today's world, we have to sort of think outside of ourselves and continue to make sacrifices. Sure, if I have to deal with little fever, body aches here and there, that's okay. I'm protecting my family, protecting my dear mother-in-law, my colleagues, right? So the theme here is self-sacrifice for the greater good.
You got any more questions, Jake?
Sure. Thank you for the answer. I really appreciate it.
You're welcome.
So, being one of the first to get this vaccine, can you just talk about the importance of, frontline healthcare workers really being the first to have it rolled out?
Great question. It is important because we're the ones constantly being exposed, whether or not we know someone is COVID positive. So I think, I've never been in the military, but I have dear friends who have been. You take out the medic, your whole unit's gone, right? So you want to do everything you can to protect your medic. We're the medics, not just the physicians, but the respiratory therapists, the nurses, the residents, the housekeepers. So that's why I think protecting frontline workers is very, very important, because we're the ones that essentially take care of you guys when you walk into the ER, when you get admitted into the hospital.
Great, thank you, Dr. Dejesus. And I think we've got up next is Dr. Jamila Holloway.
Thank you for your time, sir.
Thank you very much. I appreciate it.
Hello, my name is Dr. Holloway.
Okay, do we have hands for Dr. Holloway? Any questions? We've got Jake and Gracie again.
Hi. So just to clarify, you received the vaccine today.
Yes, I did.
Okay, so can you kind of walk me through, just your own personal experience? How did it work at the hospital, and how did it feel?
Oh, well, I actually didn't feel the shot at all. It was painless. So pretty much we had to arrive at a certain facility at Eisenhower, and then we had to get processed, just verifying that it was indeed us. And then we just received our shot, and we also had to sign a form prior to.
How do you feel so far?
I feel great. Yeah.
And how long has it been since you received the shot?
It's been about 10 minutes.
So, how would you compare it, say, to the flu shot or something that people are more familiar with, with the physical injection in your arm?
Okay, yeah, I can actually walk you guys through that if you'd like. So it was pretty much the same site as where you would receive the flu shot. So it's just going to be right on your shoulder right here. In regards to the difference between a flu shot, I guess I wouldn't really want to comment on that extensively because I know everyone is different. When I received my flu shot, however, I felt the little sensation and my arm was sore for about a day. So I guess we'll have to wait and see how my arm feels tomorrow.
No soreness yet, though.
No soreness yet.
Okay, great. And then, are you excited to be one of the first to receive it? How does that feel emotionally?
Well, I'm definitely excited. I guess today is filled with lots of emotions. I've been working in the emergency department for quite some time now, battling COVID-19. So I have seen pretty sick people, and it does break my heart going home knowing that I've tried the most to do what I can for my patients. But sometimes, with this disease and its severity, and it also just has a different variety of presentations, we do the best that we can. So if me getting the shot today means that I can protect another patient when I go into their room, that's the most important thing that I want to do.
Can you just kind of talk about, the scary moments that you felt over the last 9 months or so of this pandemic, not having a vaccine and not having that guarantee of protection?
Well, I wouldn't say I was afraid in regards to not having protection myself. At my hospital, we do have the utmost protection. They make sure we have that prior to me even going into a patient's room. I like to think of the policy, I protect myself first, and then I go into the patient's room, because if something were to happen to me, then that means I'm risking not only myself, but I'm risking other people the next time I walk into a different patient's room. So I do wear an N95 on shift, and I also wear a flu mask on top of that, as well as a face shield. And if I'm going into a COVID suspected or a COVID positive room, I do also wear a gown as well. So I do feel pretty safe. I can say I've been working for now 6 months in the emergency department, and I've yet to have any symptoms being around COVID-19 patients. So this is just more so in regards to protecting those that I am around on the day-to-day, as well as those that do not have COVID, but I still have to take care of as well.
Definitely. You feel a sense of relief today?
I do.
All right. Thank you very much.
Thank
Thanks,
you.
Jake. And Dr. Holloway, I think we might have a question from Maria Sestito from the Desert Sun.
Okay.
Hi, thanks for talking
Hi.
to us. Could you describe more what it has been looking like, in the emergency department?
Yeah.
Thank you.
Most definitely. When I first got here, COVID was definitely a real thing. It was picking up, and then we had a period at our hospital where it did indeed die down. And I think at that time across the United States, it was also reducing in numbers. And so that we did feel like at that time there was a light at the end of the tunnel. However, in the last 2 months, I'm not sure if that was due to the holiday seasons or maybe more people traveling, the numbers have unfortunately picked up. So in the last 2 weeks, we have seen quite a surge at our emergency department. It has been very hectic. We've had some really sad days, very down days, but I still have to stay positive, because if I don't stay positive and then I go into work the next day, I will risk those around me. So it is picking up. We are getting a little bit of overflow on our floors, especially in the emergency department as well. But we just have to stay hopeful. I think that's the one thing that's really important.
Thank you, Dr. Holloway. Okay, and next up we have Nurse
Thank you.
Josh Hickman.
Who also got the vaccine? Who just got the vaccine, just so they realize.
And Nurse Hickman also just received the vaccine. So he's the third employee at Eisenhower who just received the vaccine.
Hello.
And who do we have questions from? You can raise your hand. Jake.
Thank you, Lee, and thank you, Nurse, for speaking with us today. Really appreciate it.
No problem. Thank you. Thanks for taking an interest.
Of course. So just kind of talk about how you're feeling right now and, how the whole process has been for you.
Of the vaccination itself?
Yes.
Or a quote? Yeah, I feel great. Like Dr. Holloway said, we're, I don't know, probably 15, 20 minutes out now. So I've been obviously trying to be aware of any potential symptoms, but I'm maybe just elated to be here. And so maybe I feel more than great. It's an exciting thing to be a part of. I think this is like a monumental day for everyone that works here. We're all really excited. And it's, like Dr. Dejesus said, it's felt like a light at the end of the tunnel is maybe finally appearing after this grueling 9 months. And for me, this was very much just like the opportunity to stand in solidarity with my other healthcare workers, not only here, but nationwide, worldwide, who have had to suffer through this time. And we are, doing the best we can to, stay safe for our community and to keep ourselves safe so that we can be here for our community members. And we want to be able to keep you safe as well when you come, for your ailments. And that's what we sign up for as emergency healthcare workers. And this has felt like a very dangerous year in so many ways. And our, the hospital's done a great job of keeping us as protected as possible with our, with PPE. And this vaccine, though, creates something totally new. This helps us actually maybe get on the other side of this disease, and feels even better that that we're getting this on this day when we are surging and we are seeing this huge spike in numbers. It's a very important thing for us to be able to get this right now, and very important for the community as well. To feel safe about it. I feel great. There's obviously, like Dr. Dejesus pointed to, many studies are going to show, potential adverse effects to any vaccine and things like that. And without getting into details about that sort of thing, I just feel, excited to be here. There's treatable symptoms that you might be able to have. I can go home and take some Tylenol if I get a little fever. Otherwise, I feel like I've taken a step today to help protect myself, my family, my fellow workers, and the community itself. And I think that's very important to be a part of. So I'm excited to be here.
Thank you.
Thanks. Thank you, Josh. And we have April Lopez, who is the logistics coordinator for Eisenhower's COVID-19 task force. So she can answer any sort of logistical questions about how this is working with staff, how it's going to be rolled out, and she can help you answer those questions. Miss April?
Good afternoon.
Hi,
So
good afternoon.
we've got Jake asking, and Maria. Let's go with Maria real quick, Jake, and then we'll come back to you. Maria?
Hi. So could you explain, when the vaccines arrived and then how many, and then also how the order of who's going to get it first, how that was determined?
Sure. So our vaccines were delivered yesterday. We got the Pfizer vaccines initially. We have just over 1,100 doses that were allocated. And the stratification for that was based on risk. So those at risk, like the ER staff that you've met prior to me standing up here, they are at highest risk. So they, as like the ICU and some of the other COVID floors, are the first recipients for this vaccine.
Any other questions? We've got Jake.
Thank you very much. So obviously, a precious resource has been delivered today. Can you kind of talk about, all the planning that goes into rolling this vaccine out and the scheduling, obviously the precaution that needs to be taken with the temperature to make sure that none of this goes to waste?
Sure, absolutely. So we have been planning for the last 6 to 8 weeks on how to logistically receive this vaccine, monitor the cold chain process that needs to be kept to ensure that its integrity is maintained. We've worked closely with the pharmacy as well as Riverside County and the state of California to ensure all of those things are occurring. For scheduling purposes, we have a group of registrars who have been scheduling these high-risk staff members for their appointments so that they can arrive, get their vaccines, and we can get them back to work or back home so they can continue taking care of the community.
Another question from Jake.
Sure. I've heard it said before, giving everybody vaccine and obviously the risk for adverse effects, it might be important to kind of split up different departments. So, if there are adverse effects, people aren't all feeling those at once, and, your staffs don't go down. Can you talk about how you're kind of breaking it up amongst the departments and if any of what I just said is playing into it?
Of course, yes. And what you've heard is very accurate and very true. We are splitting up the departments to ensure that we don't have individuals who are experiencing any side effects that are all happening on the day after. If we vaccinated 1,000 people today, we don't want 1,000 people not feeling well tomorrow. So we split those up over the next week to 10 days to get all of these departments vaccinated as we await further allocations of additional vaccines for the rest of our staff.
And we have a question from Maria Sestito from the Desert Sun.
Yeah, so these first 1,100 doses, will that cover, everyone in all these departments? How many, do you expect to administer over the next 10 days? And do you have any idea of what percentage of workers are willing to get the vaccine at this time?
Okay, so for the first question, the 1,100 does not vaccinate the entire high risk. It vaccinates a percentage. And of those percentages, those who are unwilling, to answer your second question, those vaccines then can go to the next person on the waiting list who is at high risk and take the spot of those who are declining the vaccination. I don't have a estimated percentage right now of who is declining, as that process is still in place and we've just been scheduling just over 24 hours. So I can't give you an honest answer on percentage of declining, but I can say that overwhelmingly everyone that we're calling and speaking with is just excited, just like the ED staff said earlier, that we can be taking part in this. This is a monumental day, a historical day for all of us to hopefully be the day that starts the turn on getting to the light at the end of this tunnel.
Do we have any other questions for April? Or any more questions for any of the participants or volunteers from today? Thank you everyone for being here, and I will email you everyone's names, titles, along with B-roll from their vaccinations and photos as well. I want to thank everyone for being here and for getting the word out. Don't forget to wash your hands, keep your distance, wear a mask. Thank you so much.
Thanks.